What is vertigo?
मैम लॉस ऑफ बैलेंस ही होता है
What's loss
जिसमें
of balance?
स्पिनिंग मूवमेंट्स होती हैं
6 weeks तक शहीर को loss of balance. So today we will discuss vestibular disorders. Okay, that is called vertigo. So in the end of this lecture we will solve this scenario. Vertigo. What is vertigo? Vertigo is the hallucination of movements that are not actual movements, but it is called hallucination of the movement. So how can we control our balance? There are central vestibular system and peripheral vestibular system. Central vestibular system is cerebellum and the peripheral vestibular system is in the ear. That are the utricle saccule and semicircular canals. Okay. Semicircular canals contain semicircular ducts. Bony labyrinth is called semicircular canal and the membranous labyrinth is called semicircular ducts. Okay, utricle and saccule control static movement and semicircular canals control the rotational movements. Okay, so this is membranous labyrinth. In membranous labyrinth there is fluid called Zarafsha, still absent. Abdullah. Okay, what is inside the membranous labyrinth? Aisha? Aisha?
Endolymph.
Absent. Aisha Malik, what is inside the membranous labyrinth?
Endolymph.
Endolymph. Okay. And in the bony labyrinth, there is perilymph. Okay. So endolymph circulates in a closed sac. Closed sac means its drainage is not in the CSF. Perilymph drains into the cerebrospinal fluid, but endolymph circulate in the closed circle. How does it form? It is formed by the stria vascularis at the lateral wall of scala media. Okay. So in this diagram, you can see this is external ear, middle ear, and inner ear. Inner ear has bony labyrinth and membranous labyrinth. Okay. In bony labyrinth, there is perilymph, rich in sodium, and in membranous labyrinth, there is endolymph, rich in potassium. Okay. So there are cells in the lateral wall of scala media. These cells produce endolymph. Okay. This endolymph circulate in the endolymphatic system and is collected in the endolymphatic sac. Endolymphatic sac is in this diagram. You can see this is stria vascularis in the wall of the scala media. This is scala tympani, scala vestibuli, scala tympani, and scala media. And scala media is the endolymph. Okay, so it is formed by scala stria vascularis and rich in potassium. Okay, its chemistry is different from cerebrospinal fluid due to increased concentration of potassium. Okay, this circulate from cochlear duct into the utricle and saccule. Then semicircular canals also contain semicircular ducts also contain endolymph, and in the last it is collected in the endolymphatic sac that is present in the posterior fossa of the cranial cavity. Posterior wall of the vitreous bone, endolymphatic sac is present. Okay, so whenever it forms by the stria vascularis, and where does it go? It drains into the brain, into the blood. Okay, through diffusion. Okay, so there is no opening. It is closed sac. It is formed by stria vascularis, and where does it go? It drains into the blood through vessels. So whenever there is abnormality of either increased formation or decreased absorption, there will be dilatation of endolymphatic system. Okay. Either there is increased formation or decreased absorption, there will be dilatation of endolymphatic system. So when we classify vertigo, there is extrinsic vestibular disorders and intrinsic vestibular disorder. Extrinsic means outside the ear, outside the peripheral vestibular system. So there are vestibulotoxic drugs such as streptomycin, anemias, hypoglycemias, hypotension, and otitis media. Okay, these are the extrinsic that are outside the inner ear. Then trauma to the skull fractures, longitudinal fractures, and transverse fractures, surgeries, surgical trauma. When we perform mastoidectomy and staphylectomy, we can induce vertigo. So internal vestibular, peripheral vestibular disorders, it means disease is inside the inner ear. These are Meniere's disease, vestibular neuronitis, sudden vestibular failure, benign paroxysmal positional vertigo, and labyrinthitis. Okay. Then there are certain vascular disorders that can produce vertigo, posterior inferior cerebral artery infarction. There will be decreased blood supply to the peripheral vestibular system, and basilar migraine. It also will cause decreased blood supply of the vestibular system and can cause vertigo. So we will, for ENT point of view, important thing are the disorders that are present inside the inner ear. Okay, these are the Meniere's disease, vestibular neuronitis, sudden vestibular failure, benign paroxysmal positional vertigo, and labyrinthitis. And also then central vestibular disorders. CP angle tumor, most important is acoustic neuroma, multiple sclerosis, demyelination of nerve, then epilepsy and psychogenic disorders. These all can also cause vertigo. In this, acoustic neuroma is important because it presents with tinnitus and hearing loss. It involves the vestibular nerve. So what is nystagmus? What is nystagmus?
Uncontrolled, eyes make repeated uncontrolled movements.
So these are the rhythmic, oscillatory, involuntary movements of the eyeballs. It is uncontrolled movement. Okay, uncontrolled, rhythmic, oscillatory, involuntary movements of the eyeballs is called nystagmus. Okay. So pathogenesis क्या होगी इसमें? Inability to focus, because this vestibular system has its connection with ocular tract, extraocular muscles, has its connection with spinal tract, that is called vestibulospinal tract, and its connection with parasympathetic system, that is with vagus. Okay. So because of stimulation of all these symptoms, all these tract, stimulation of all these nerves, will produce specific symptoms in vertigo. So in peripheral vestibular system, whenever there is stimulation, there will be vertigo. Due to vestibulo-ocular tract, there will be nystagmus. Each vestibular system controls the movement of medial rectus of same side and lateral rectus of opposite side. Okay, so this involuntary contraction will cause slow movements of eyeballs towards the opposite sides. Then the brain will realize, and these eyeballs will come to the center. That is called fast component of nystagmus. Okay. So this slow component is due to stimulation of vestibular system and fast component is due to brain. So there will be nystagmus will always be with vertigo, with peripheral vertigo because of this vestibulo-ocular tract connection. Okay. Then why will there be imbalance? Vestibulospinal tract. There is connection with the vestibulospinal tract. When there is disturbance in this connection, there will be imbalance. And you can assess this imbalance by doing Romberg test. You will ask the patient to stand straight and close his eyes. If there is failure of any vestibular system, patient will fall towards that side. Then vegetative symptoms means nausea and vomiting and diarrhea due to connection of vestibular system with vagus nerve. So patient will feel nausea, vomiting, and there may be diarrhea. So peripheral vestibular system, we have discussed it. It contains vestibule, utricle and saccule, and semicircular canals. Semicircular canals are bony labyrinth, vestibule is bony labyrinth, and inside this is utricle saccule in vestibule, and in semicircular ducts are in the semicircular canals. Central vestibular nuclei and cerebellum. Okay, this constitute the central vestibular system. Okay, Umayman. So peripheral vestibular system is inside the ear and central vestibular system is in the brain. Okay, cerebellum and vestibular nuclei are the central vestibular system. So nystagmus, how can you assess the severity of nystagmus? Okay, there is this formula of 3 Ds: direction, horizontal, radial, and rotatory. Okay. When you will examine a patient of nystagmus, you will see the direction of nystagmus. Where is the direction of nystagmus? So direction is always related to fast component of nystagmus. If these are the eyeballs and there is stimulation of right vestibular system, eyeballs will slowly move towards the left because of contraction of medial rectus of same side and lateral rectus of opposite side. So this is slow component of nystagmus. Okay. Then brain will realize that these are the false movements. Brain will bring these eyeballs in to the center with jerky movements. This is called fast component of nystagmus. Okay. So there are 2 components, fast and slow components. Direction of nystagmus is always towards the fast component. So if right vestibular system is stimulated, where will be the fast component? Lateral rectus. तो eyeball slowly left पे move करेंगे, ठीक है? Then brain will realize that these are the false movements, and brain will bring the eyeball into the center. Okay, So this is the fast component. So where will be the fast component?
Ma'am, central.
When there is a stimulation of vestibular system, fast component will be towards that side. If fast component is towards the stimulatory side, it is called, we can see that it is nystagmus of less severity. ठीक है? फिर क्या होता है? When there is paralysis of vestibular system, अगर right side का paralyze हो गया है, तो opposite side will bring the eyeballs towards the right side. Then brain will realize these are the false movements, and brain will bring the eyeballs to the center. It means towards the left side with jerky movements. So this will be opposite. Okay? Clear हुआ है ये?
जी मैम।
मैम दोबारा एक्सप्लेन कर सकती
नहीं हुआ।
हैं?
There is stimulation of right vestibular system. Okay? So eyeballs will move slowly towards the left side because of contraction of right medial rectus and left lateral rectus. इतना समझ आ गया?
जी इतना समझ आ गया। मैम आपकी स्लाइड्स डिसअपीयर हो गई हैं।
क्या हो गया?
स्लाइड्स नजर नहीं आ रही हैं आपकी स्क्रीन से।
वो मैंने खुद ही बंद किए। आप मुझे ये बताओ ना कि अभी इतनी बात समझ आ गई? अच्छा, फिर ब्रेन ने रियलाइज किया कि दीज आर द फॉल्स मूवमेंट. ब्रेन विल ब्रिंग द आईबॉल्स टू द सेंटर. अब जब सेंटर में लाने के लिए किधर आईबॉल्स मूव करेंगी? लेफ्ट साइड. लेफ्ट साइड पे मूव करेंगी तो सेंटर में आएगा. ऐसा है?
जी ऐसे ही।
ठीक है. सो फास्ट, दिस विल बी द फास्ट मूवमेंट ऑफ आईबॉल्स. This is called fast component of nystagmus. So direction of nystagmus will be towards the same side as the disease is stimulatory disease is in the right ear. So direction of nystagmus will be towards the right side. Okay.
जी मैम चलें समझ आ गई।
अब there is paralysis of vestibular system. Vestibular system has been destroyed by the disease. Okay. Right vestibular system has been destroyed by the disease. फिर क्या होगा? There will be increase action of left vestibular system. अब left का हुआ है तो there will be contraction of left medial rectus and right lateral rectus. तो eyeballs will slowly move towards the right side. उल्टा हो जाएगा. ठीक है? Then brain will realize these are the false movements. Brain will bring eyeballs to the center with jerk. Center पे लाएगा तो left पे move करेंगे तो center पे आएगा. ठीक है? Clear है ये?
जी मैम क्लियर हो गया। थैंक यू।
The direction of nystagmus. So initial stage when disease is involving one vestibular system, nystagmus will be of same side. It means disease is less severe. When disease has damaged the vestibular system, nystagmus will be of opposite side. It means disease is severe and has damaged the vestibular system. So with the help of direction of nystagmus, you can assess the severity of disease. Nystagmus, okay? When you are checking the nystagmus, you are putting your finger in front of the patient eyes, okay? And you will ask to rotate his eyes with the movement of finger, okay? If patient, there is nystagmus, while patient is looking towards the side of disease. If right side is disease side and there is nystagmus, you are inducing nystagmus by asking the patient to look at right side. So it means that severity of disease is less. Okay. When patient has nystagmus while looking in the center, disease is of moderate severity. If there is nystagmus while looking towards the healthy side, it means nystagmus disease is severe. Okay. So first you will ask the patient to look towards the disease side. If there is nystagmus, then you will ask the patient to look straight. If there is nystagmus, then disease is moderate. And when you will ask the patient to look at the healthy side, and if patient has nystagmus, it means disease is severe and patient has severe degree of nystagmus. Okay, now the duration of nystagmus. Central nystagmus is persistent and peripheral nystagmus is of short duration.